Hi, my name is Kyle Clower and I'm with Serve Wisconsin. We are the Wisconsin National Community Service Board and we work the AmeriCorps programs throughout the state. Right now we're interviewing different AmeriCorps members to talk about their experience serving this year and how it was impacted by the COVID-19 pandemic. And today we're talking with Parijat. So Parijat, how are you doing today?
Doing pretty well. Thank you.
Thanks so much for talking with us today. And Parijat, could you start off by telling us about the AmeriCorps program you're serving with and what your service looked like this year before the spread of COVID-19?
Hi, my name is Parijat. I'm an AmeriCorps member serving with Volunteer Wisconsin for the term 2019-2020. I've been serving at the Marshall Clinic with the Marshall Child Advocacy Center as part of my program, and it's been pretty interesting actually. So I'm assuming not everybody would know, but Marshall Child Advocacy Center is a sort of a combined social service and medical support organization for kids who have been victims of trauma and abuse. And working here, I got to interact with kids on a near daily basis. I was responsible for several, like administrative duties that kind of came in. Well, I say administrative, but, just kind of a lot of organizing the program, special projects that kind of came with the role, and just the general, working in a clinic atmosphere versus an organization that's solely dedicated to social service. So it's been very interesting. I can honestly say that no 2 days have been alike. It's just been a wonderful experience. And I mean, when we go past that, just the AmeriCorps year has been phenomenal. Our program managers have been amazing. Shout out to Brian and Shelley, and they've provided us support throughout the year. And the special opportunities that we've been able to get have been very interesting.
And then what are some of the specific activities you'll be doing with the children when they came into the center?
Obviously, as a part of Volunteer Wisconsin, my primary responsibility is recruiting volunteers and training them to support the social service organization I'm working with. However, when we didn't have volunteers present, I was often tasked with kind of helping with the childcare for patients that were coming in. And I mean, it involved, anything from literally, just kind of playing games with the kid all the way to, doing health assessments, needs assessments for the families that had come into the center. When we talk about childcare, specifically with kids that have been victims of trauma, oftentimes their behaviors are severely influenced. Some might not be able to regulate their emotions, some might be hyperactive, some might, prefer to kind of just stay away from everybody. So working at the CAC, I actually had to get, I was actually specially trained to work with kids, patients that were coming in that had experienced trauma, and, just how to interact with them, how to make them feel safe, because, there's a difference between being safe and actually feeling safe. So beyond that, I would say, beyond that, there was also kind of maintaining the sanitation that followed all patients, and it wasn't just standard cleaning partly because of right now because of COVID-19. So every patient that's coming into the center, we have to make sure that the center gets sanitized and perfectly ready for the next visit.
And then Parijat, with your service based around children coming into the Child Advocacy Center and then working with the volunteers that help the children, how was your service impacted by the spread of COVID-19?
COVID-19 was just kind of threw everything out of whack. I would, prior to COVID-19 kind of disseminating through the population, my responsibilities were kind of separated into three parts. There were special projects and events that MCHS would be doing. There was, childcare, and then there was, the AmeriCorps member part, which is volunteer recruitment, volunteer training, the volunteer program organization, and, preparation. As soon as COVID-19 hit, CAC kind of had to, put a hold on all patient visits. So that just, kind of throws half of the stuff I'm doing out the window. Then because of COVID-19, volunteer services shut down. So that was gone as well. So, originally it was kind of a rushed thing where, in the beginning, everything was just kind of chaotic because you don't really know what to do. However, as kind of time went on, all my secondary responsibilities, so any special projects I wanted to do for the CAC, they became primary, and I kind of started working on that. But I'm talking about a week and a half period. But within that window, MCAC actually sort of redesigned or refocused its resources. So the Marshall Child Advocacy Center actually started reaching out to all the families that they had worked, that they were working with presently or had worked in the past, and just the community at large. And we started seeing needs that the families had because of COVID-19. You know, like people were getting furloughed left and right, people are getting laid off left and right. So that kind of brought in a lot of needs for the families. Like all of us, like, you know, a lot of Americans live paycheck to paycheck. So all of a sudden, when you don't have a paycheck, you don't know where you're going to get the food. And if you're going to get the food, is it going to be healthy? How are you going to pay rent? How are you going to pay utilities? How are you going to keep the internet going when the kids need internet to finish their schooling? You know, how are you going to keep your phones running so you can actually, you know, live and stay connected to people outside if you're actually, you know, social distancing and staying at home? So we started doing, you know, more intensive needs assessments of the families that that we were contacting or were coming to the center. You know, we started figuring out, oh, what are your needs? We actually applied for a grant. We actually received I can't remember exactly how much money right now, but the Child Advocacy Center received a substantial grant to help support the community. And that's, you know, I was a part of that. I was responsible for, you know, making those calls, connecting with the families. When the entire CAC team would kind of come together, actually advocating for the family, like, oh, we definitely should address this need, you know, because without it, they're kind of up the creek without a paddle, that kind of stuff. But as the Child Advocacy Center kind of starts opening up more and more, you know, we've restarted doing our patient visits. So it's sort of going back to the norm, but not quite there because, you know, I mean, there's special criteria. So the entire Child Advocacy Center, you know, wherever the patient goes, those areas need to be specially, you know, sanitized because COVID-19 can stay on surfaces up to 11 days. In fact, up to 9 days. So every toy the kids are playing with, you know, every single physical space of that, you know, area has to be cleaned, sanitized, and just made ready for the next family. But you know, you can't exactly make a clean room because clean rooms aren't exactly kid friendly. You know, they won't put the kids at ease. So that's what I've been kind of doing. Beyond that, planning out, you know, what the next AmeriCorps member, you know, that will follow me, you know, what kind of projects are they going to do? Figuring out how I can actually make their term more pleasant and more manageable. Like, you know, how can I make it so that they are actually able to help the Child Advocacy Center better?
Yeah, so it's definitely been a series of challenges trying to get everything together. And then once the children start being able to come back as patients, it still has a lot of unique challenges due to COVID.
I want to say like it's messy, and it is, but I'll also say it's very exciting if that's the right word, because, you know, it's a new challenge. You know, I was never able to, you know, fall into a rut. There was no real routine. And personally, I'm a huge fan of that. I like the challenge. I've learned so much while being a part of the AmeriCorps team, you know, while being part of the Child Advocacy Center team, and it's just been fun.